Dorothea Orem's theory of self-care deficit. Dorothea Orem's self-care deficit theory focuses on and defines nursing as an activity aimed at helping others provide and manage self-care. The main goal is to improve and care for human work at the house level of effectiveness. The focus and function of the theory are directed at the ability of each individual to take care of their health. Dorothea Orem defined the ability to take care of oneself as performing a set of actions that an individual commits to maintain health and life. Thus, a circumstance that confirms the need for adult care is the lack of ability to maintain personal care in the required quality and quantity constantly. Orem's self-care deficit theory is based on the opinion that while maintaining certain independence of individuals in caring for themselves, their recovery occurs faster. The theory assumes that one of the manifestations of human activity is the development and transfer of the means and ways of contributing to oneself and others. Orem's hypothesis, within the theoretical framework, emphasizes that mature people can experience deprivation and discomfort in the framework of actions aimed at caring for themselves or others. This assumption also includes activities aimed at maintaining life and regulating its functions. Within the framework of the theory, the metaparadigm of nursing is also essential. Most theorists emphasize that they view the person, care, nursing, and the environment as a metaparadigm of nursing theories. Within the framework of the metaparadigm of nursing theories, such aspects as intellectual, biological, psychological, and socio-cultural factors are distinguished in a person. Thus, each nurse's patient is a system that changes with the environment. The environment is understood as the geography of human experience within the framework of society and a specific context of this experience in everyday life. Typically, these environments include social customs and norms of tradition and belief. It is an energy field inextricably linked with the human energy field. The environment can be defined as a field of activity within which a nurse may face caring attitudes or threats to well-being. Health refers to the synthesis of wellness and illness, which determines the patient's perceptions throughout life. This process focuses on many areas of the patient, including aesthetic, moral, and physical. In this case, the level of health is understood as the process of interaction between the individual and the environment. Nursing is an essential element of the metaparadigm. Within this discipline, nurses use critical thinking as well as clinical judgment to deliver evidence-based patient care. The main goal of nursing is to take care of patients and humanistically improve the health potential of individuals. The theory defines a person as a physical, psychological, and social being with a varying level and skill in self-care. However, even though the person is a beneficiary, they have some potential for development and learning to meet the needs of personal care. Moreover, the theory implies that a person differs from other creatures by their ability to blur and take care of themselves and their environment. People use their thinking for creative ideas to do valuable things for themselves and others. The most critical metaparadigm is health, which in theory means physical, mental, and social well-being. Human integrity is a fundamental goal of the grand nursing theory within this concept. Therefore, the main principle of the theory is the creation of a vision to improve and maintain the health of the population. In the Orem model, it is also necessary to consider the environment, which is described as an indicator of human existence in this environment. According to the provisions of the theory, man and the environment are disparate entities. Therefore, efforts are required to conceptualize these two concepts as a whole. The idea of the environment, in theory, focuses on representing it as interrelated factors that affect human abilities. According to the theory, nursing is a unique field of knowledge, action, and professional practice. Thus, nursing care is viewed as an intervention that aims to satisfy self-care and medical care for patients. Orem's theory can be used in an outpatient surgery setting for a practitioner. In this concept, the nurse acts as an aid, teaching, guiding, and creating the learning environment. The nurse's role and the level of care in this model can range from complete care to educating the patient and family members. Additionally, the theory mainly focuses on motivation, experience, and skills that a patient can acquire. Therefore, it can provide the necessary foundation for the research of patients with chronic diseases and their motivation and self-care. Within the advanced nursing roles, the theory allows for the assessment of patient care, which will help base medical and nursing interventions based on the obtained data. In conclusion, it should be said that Orem's self-care deficit theory is a relatively simple concept that can be applied to a wide range of individuals. The theory includes such vital provisions as self-help and the definition of metaparadigm within the framework of the theory. Additionally, the theory is about the patient's desire and motivation to take care of himself. However, even though this theory takes the independence of each patient as its primary position, in cases where a person needs full consideration, it cannot be applied.